Hi, everyone. My name is Dr. Rehan Saeed. I'm going to talk today about one of the commonest problems that we face in endocrinology clinics. And I've always been getting questions from people on this. That's thyroid swelling. So some people, once they know that they have a thyroid swelling, they get worried and they start wondering what should they do, what to expect, and whether this is a serious problem. Now, if you've got a thyroid problem, it's one of two. So it's either the whole gland is enlarged, and this, what we call a goiter, or it can be part of the gland or a lump, part of the thyroid that's enlarged, and this is what we call a thyroid nodule. So, so what happens if you got this swelling? So, a doctor would usually request two things. One is what we call a thyroid function. It's a blood test that shows us all the hormones that the thyroid produces. And the second important investigation is the ultrasound scan, which shows us how the thyroid look, whether there is anything that need to be concerned about, whether it's uniformly enlarged, or whether there's only one part of the thyroid that's involved. So if the whole of the gland is enlarged, as I mentioned before, we call it goiter. And if you have this goiter, then there are two things we look at: the function of the gland and whether it's causing any pressure symptoms. Now, the thyroid gland function is shown by the blood tests I mentioned earlier. So either you have a goiter with a normal function, and then that's nothing to worry about. And the other thing, you can have a thyroid that's overactive, so it's producing too much hormones, or underactive, and it's producing too little hormone. Now, I'll come back to the management of these later, but then the second thing we need to worry about is whether the thyroid is causing any pressure symptom. So what symptoms are we talking about? We're talking about breathing problems and swallowing problems. So if the thyroid, mostly if they're small, goiters don't cause any pressure symptoms, but if they start to increase in size, some people may find some discomfort when they're eating and breathing, and then this is where people need to report that to their doctor. Now, many of the people who worry about their thyroid enlarged, many of them have just a goiter, which is small, normal function, and no pressure symptom. This group of people, they don't have to worry. All we do is to observe the thyroid, and that's by clinical visits, and then doing blood tests that can be done on a yearly basis. They don't need to be frequent, and there is no need for treatment. So that's the most important thing, message we take from here. If you have a goiter, it's not causing any problem, the blood tests are normal, do not worry, you don't need treatment. Now, when do you need treatment? You need treatment for goiter if you have abnormal functions. So if it's overactive or underactive, then you need treatment. Mostly we start with tablets. So that's the common thing. So what if this goiter is causing pressure symptoms? If it's growing up and causing pressure symptoms, then we may send you for surgery. As long as there are no pressure symptoms, no need to worry. Okay, so that was about goiter. Now, what if patient have a nodule? Okay. So nodules are usually assessed by doing an ultrasound. So An ultrasound will help us first to know how the nodule look, how big is it, and whether we need to take a sample or no. If we decided to take a sample, then the ultrasound again will help us in taking the sample and make the process so easy. Then based on that sample, which we examine under the microscope, then we'll decide whether we just observe that nodule, if it's not causing any trouble, or whether to proceed for surgery. So my important messages for today is, if you have a small goiter, if its function is normal, do not worry. It's nothing sinister, and as long as you've been followed, you don't need any treatment now. But if you have any problem swallowing, or problems in breathing, or if the goiter increases in size, like rapidly, or the nodule has been increasing rapidly, then please let your doctor know to check what's going on. Now, the third point is, if you have a single nodule, you need to know that you may need an ultrasound guided biopsy, but that doesn't necessarily mean that's something serious. Okay, this short video helped you know a little bit more about thyroid swelling, and I promise I'll do more videos on endocrine problems. Thank you, and bye-bye.